Ready, sir?
Good afternoon, dear students. So now let's see the procedure of NG tube removal. Okay, we have already seen the NG tube insertion, NG tube feeding. Now the third aspect of that procedure is NG tube removal. Once the patient is ready to eat by themselves, then you will proceed for removal of the NG tube following a physician order. Okay, so let's check what is the procedure written for this patient. Okay, the physician has advised for removal of the NG tube and normal diet. Okay, so same like any other procedure, you have to make sure that you have done the hand hygiene and you have to introduce yourself. Hello sir, how are you?
Okay.
So as we are happy to notice that you started eating by yourself, your swallowing difficulty has reduced. So we have decided to remove the NG tube. So I will be just checking your ID band. Please tell me your full name.
Muhammad Ali.
Okay, Muhammad Ali, you are my right patient. So I will be just helping you to take out this tube and then you will be able to proceed with your normal diet. Okay, before proceeding with that, I will be doing an assessment for the patient. So what assessment is very specific to before removal of NG tube is assessment of the bowel sound and assessment of any presence of nausea or vomiting in the patient. So let me know from you sir if you feel nauseated or vomiting, because we kept the tube closed for some time. So do you feel anything like that?
No.
Okay, good. So let me check the bowel sounds. So as you have learned in the feeding video, you will be checking the bowel sounds. Okay, so the bowel sounds are good. So you need to maybe wait for 1 minute to 5 minutes to listen in all the quadrants. But here I have got the bowel sound, so it is fine to remove. So you have to make sure that you have already secured during the feeding. With a safety pin, the tube is already attached to the patient dressing, so you have to make sure that this is loosened. Okay, and also the tape is loosened, tape which you have used to fix at the nose edges. This will be difficult to remove if you wear the glove, that is why you have to just loosen it. Okay, and then you will be using your gloves because you are going to, maybe if there is any spillage of fluid from the tube, so to avoid that you have to make sure that you are protecting yourself. And it's optional. Okay, you can just inject 50 ml of air, just air into the tube before removal, so that if there is any fluid along the tube, this will be completely removed. And whenever you are removing, you have to make sure that you are pinching the tube. Okay, and also for the safety of the patient linen, you can place an InQ sheet, okay, across the chest of the patient, and you will be giving a tissue paper. Okay, sir, you can keep this in your hand, and if you want to wipe your face after the removal or in between to clean your face, you can use this. Okay, so you will be pinching the tube, same like insertion, feeding time, all we were pinching the tube to avoid the entry of air. So you have to remove the cap and then you will be instilling the air so that the tube is cleared completely of any fluid. Okay, and then you will be coiling the tube in your hand, okay, so that it doesn't spill anything, no fluid is spilled anywhere. Okay, so the tube is completely in your hand. Please check the tube is for complete removal. Okay, if the tube is complete, now no part is missing. And also make sure that the patient's nose and the mouth is clean. Okay, and same like all other procedure you have done, you have to remove this safety pin. Make sure that this is being kept separately, and this tube inside your gloved hand, and you will be removing it, and this along with the other glove, so that completely you are not touching the tube at all, and this will be discarded in the yellow bin. Okay, and then you will be taking out the ink sheet and asking the patient, okay, how are you, sir? Is it okay? Do you feel any discomfort now?
No.
Okay. So this is now you may be proceeding with your normal diet. Okay, you can take rest. Is this position okay for you?
Yes.
Okay, so the patient will be allowed to sit in the comfortable position, and you will be proceeding with your documentation of removal of NG tube. Okay, if there was any gastric content or anything which you notice which is removed, that has to be recorded in your document, and the patient is given a comfortable position. If the patient is comfortable, there is no nausea, vomiting, all this, you will be recording in your chart, and you will discard all those what you have collected, the tube and the gloves, whatever you have used in the yellow. Okay, that's about the procedure. Thank you.